told his wife he was just tired. That was on a Monday. He had spent the weekend doing nothing more strenuous than reading in his armchair and walking to the mailbox. But by Sunday evening, he felt a heaviness in his body that sleep did not fix. Monday morning, he woke up exhausted, not sleepy. Exhausted. The kind of fatigue that sits deep in your chest and makes even lifting a coffee cup feel like it requires a decision. His wife asked if he was feeling all right. He said he was fine, probably just a bad night of sleep. On Wednesday, he felt the same heaviness, but now there was something else. A vague discomfort across his upper back that he could not quite describe. Not pain exactly, more like a pressure that would not leave. He took 2 aspirin, sat in his chair, and told himself it would pass. On Thursday afternoon, his wife found him on the kitchen floor. He had suffered a massive heart attack. He survived, but barely. And when his cardiologist later reviewed the timeline, she said something his wife will never forget. The heart attack did not happen on Thursday. It had been announcing itself since Sunday. Every signal was there. He just did not know what he was hearing. I am Dr. Arya, and on this channel, Senior Health, I focus on the truths about your body after 60 that do not get enough attention, the quiet warnings that hide behind ordinary explanations until the moment they cannot be ignored anymore. Today, I need to talk about a symptom that is so common, so easily dismissed, and so frequently misattributed to normal aging that it may be the single most overlooked warning sign in cardiovascular medicine. And if you are over 60, understanding this one symptom could be the difference between catching a heart attack before it happens and missing it entirely until you are on a hospital floor. The symptom is unexplained, sudden fatigue, not the tiredness you feel after a poor night of sleep, not the natural slowdown that comes at the end of a long day. I am talking about a fatigue that arrives without a proportional cause, a heaviness that seems to come from nowhere, settles into your body, and does not respond to rest. The kind where you slept 7 or 8 hours and woke up feeling like you had not slept at all. Where tasks you performed easily last week now feel like they require enormous effort. Where you find yourself sitting down more often, cancelling plans you were looking forward to, and telling everyone around you that you are just a little tired lately. That fatigue, the kind that does not match what you have been doing, may not be fatigue at all. It may be your heart telling you that it is struggling, and it may be the only warning you get. Let me explain exactly what is happening inside your body when this occurs, because once you understand the mechanism, you will never dismiss this feeling casually again. Your heart is a pump. Every minute of every day, it pushes roughly 5 liters of blood through your entire circulatory system, delivering oxygen and nutrients to every organ, every muscle, every cell. When your heart is functioning normally, this process is so seamless you never think about it. You have energy because your body is receiving what it needs. But when a coronary artery begins to narrow, when plaque buildup starts restricting the flow of blood to the heart muscle itself, something shifts. Your heart does not stop working. It does not send a sharp pain to your chest as an immediate alarm, at least not at first. Instead, it starts working harder to compensate. It strains against the reduced flow. It labors to maintain output with a diminished supply. And that increased cardiac workload steals energy from the rest of your body in a way that feels exactly like profound, inexplicable tiredness. Your legs feel heavy. Your motivation disappears. You cannot understand why walking to the end of your driveway leaves you winded when you did it without thinking 2 weeks ago. You blame your age. You blame the weather. You blame poor sleep. And all the while your heart is slowly starving for oxygen, and the fatigue you are feeling is the distress signal it is sending to every system in your body. Here is why this is so critically dangerous for adults over 60. In younger patients, heart attacks tend to present the way television has taught everyone to expect. Crushing chest pain, left arm going numb. Dramatic, unmistakable, impossible to ignore. But research published in the journal Circulation found that in adults over 65, more than 40% of heart attacks present without classic chest pain. 40%. Nearly half. Instead, they present with what physicians call atypical symptoms, unexplained fatigue, shortness of breath during activities that previously caused none, upper back discomfort, jaw tightness, nausea that seems unconnected to anything you ate, a general sense that something is wrong but you cannot pinpoint exactly what. These atypical presentations are especially common in women over 60 and in adults with diabetes, where nerve damage can mute the pain signals that would otherwise make a cardiac event obvious. The heart attack is happening, the damage is occurring. But the body's alarm system is sending a whisper instead of a scream. And because the symptom looks like ordinary tiredness or mild discomfort, people wait. They wait hours. They wait days. They wait until the heart muscle has sustained damage that could have been prevented if they had recognized the whisper for what it was. I want you to think about something honestly. In the last 2 weeks, have you experienced fatigue that seemed disproportionate to what you were doing? Have you felt winded climbing stairs that did not bother you a month ago? Have you noticed a heaviness in your chest, your back, your jaw, or your shoulders that comes and goes without explanation? Have you felt a vague sense of something being off, not dramatic enough to call a doctor, but persistent enough that it has lingered in the back of your mind? If you recognized yourself in any of those, I am not telling you to panic. I am telling you to pay attention. Because your body is trying to communicate with you in the only language it has, and the difference between a good outcome and a devastating one often comes down to whether you listened or whether you explained it away. Let me tell you about a pattern I see with alarming regularity in clinical practice, because it illustrates exactly how this goes wrong. A patient comes in for a routine visit. I ask how they have been feeling. They mention being more tired than usual. I ask for how long. They say a few weeks, maybe a month. I ask if they have noticed anything else, any discomfort, any breathlessness. They pause. They say something like, well, now that you mention it, I have been getting a little winded going up the stairs, but I figured that was just age. Or they say, I have had this tightness in my shoulders that I assumed was arthritis. Or they say, I have not been sleeping well and I wake up feeling like something is sitting on my chest, but it goes away after a few minutes, so I did not think much of it. Every single one of those sentences contains a potential cardiac warning sign wrapped inside a perfectly reasonable alternative explanation. And that is exactly what makes this so dangerous. There is always another explanation available. There is always a way to rationalize it. Age, stress, poor sleep, arthritis, inactivity. The explanations are endless, and every single one of them feels more comfortable than the possibility that your heart is in trouble. But comfort is not the same as safety. And the cost of choosing the wrong explanation can be catastrophic. There is a medical concept called the prodromal period. It refers to the days or even weeks before a major cardiac event during which the body sends early warning signals. In a study published in the European Heart Journal, researchers found that nearly 70% of heart attack patients experience prodromal symptoms in the month preceding their event. The most commonly reported prodromal symptom was not chest pain. It was fatigue. Unusual, persistent, disproportionate fatigue that the patients universally dismissed as something else. They had an entire month of warning. Their bodies gave them weeks of advance notice, and almost none of them acted on it because nobody had ever told them that tiredness could be the sound of a heart attack approaching. I am telling you now. This is me telling you. Fatigue that does not match your activity level, especially if it is new, especially if it has persisted for more than a few days, especially if it is accompanied by even one other subtle symptom. Breathlessness, back discomfort, jaw tightness, nausea, a feeling of heaviness in your chest, deserves medical attention. Not next month. Not at your next scheduled appointment. Soon. This week. Here's what I want you to do, and it could be the most important action you take this year. First, start paying attention to your fatigue with new eyes. When you feel tired, ask yourself a simple question. Did I do something today that justifies this level of exhaustion? If the answer is no, make a note of it. Write the date, what you were doing, and how the fatigue felt. If it happens again the next day, write it down again. If it persists for 3 or more days without a clear cause, call your doctor. Do not wait for it to become dramatic. Prodromal symptoms are quiet by nature. They are not designed to be dramatic. They are the early signal, the one you catch if you are paying attention and miss entirely if you are not. Second, learn the atypical warning signs and stop waiting for the Hollywood heart attack. Chest pain is not the only signal. In many people over 65, it is not even the primary signal. Jaw pain or tightness that comes and goes. Discomfort between the shoulder blades. Shortness of breath with minimal exertion. Nausea without a dietary explanation. Unusual sweating, particularly cold sweats that seem unconnected to temperature or activity. Any of these combined with unexplained fatigue should elevate your concern immediately. Third, if you take daily medications, particularly blood pressure or cholesterol medications, do not assume that because you are medicated, you are fully protected. Medications reduce risk. They do not eliminate it. A controlled blood pressure reading and a normal cholesterol panel do not mean a cardiac event is impossible. They mean the odds are better. But odds are not guarantees, and the warning signs still deserve the same vigilance regardless of what medications you are taking. Fourth, tell the people closest to you what to watch for. Many cardiac events in older adults are first noticed not by the patient but by a spouse, a child, a friend who observes that something seems different. If your wife notices you are unusually quiet, if your son thinks you look more tired than normal, if a friend says you do not seem like yourself, listen to them. They may be seeing what your own rationalizations are preventing you from recognizing. Want to come back to the man from the beginning of this video. His wife noticed on Monday that something was wrong. She asked. He dismissed it. She noticed again on Wednesday. He dismissed it again. He had 4 full days of warning from his own body and concern from the person who knew him best, and he overrode every signal because the symptom did not look the way he expected a heart attack to look. It did not feel like an emergency. It felt like tiredness. And that is precisely why it was so dangerous. Your body does not always shout when something is going wrong. Sometimes, especially after 60, especially with the heart, it speaks quietly. It sends fatigue instead of pain, heaviness instead of crisis, a whisper instead of a scream. Your only job is to stop explaining away the whisper and start listening to it. If this video made you think about a feeling you have been dismissing, do not ignore that thought. Act on it. Call your doctor this week. And send this video to someone you love who tends to push through tiredness without questioning it. That conversation could matter more than either of you realize. Subscribe to this channel because next week we are going to talk about the 5 foods that silently inflame your arteries after 60 and how replacing just 2 of them can measurably reduce your cardiovascular risk within 30 days. Everything I have shared today is based on current cardiovascular research and my clinical experience, but it is general health education, not personal medical advice. Your symptoms, your history, your medications, and your risk factors are unique to you. If you are experiencing any of the warning signs I described today, please do not use this video as a substitute for professional evaluation. Contact your physician. If symptoms are severe or sudden, call emergency services immediately. Your life is not something to gamble with, and the right response to a whisper from your heart is never to turn up the television and pretend you did not hear it. Take care of yourselves. I will see you next week.